let us look at the chords of the brachial plexus, which are 3 in number and they are in the axilla. As you're talking about the 3 chords of brachial plexus which are in the axilla, you see how they are formed and what they are going later. This we have to discuss. So, how they are formed? Yes. Okay, let us see a schematic diagram then. There are 3 chords of brachial plexus in the axilla. And tell me how the lateral cord is formed. Actually, it was the anterior division of the upper trunk and middle trunk joining. So, anterior division of upper trunk and middle trunk will join to form the lateral cord of brachial plexus, whereas you have seen posterior division of the upper trunk, middle trunk and also the lower trunk will join. So, when the posterior division of the upper trunk, middle trunk and also the lower trunk join, they form posterior cord of the brachial plexus, which will form the posterior nerve of the arm, which is called radial nerve. So, posterior cord of the brachial plexus coming from posterior division, forming the posterior nerve, the radial nerve. Yes. And what is left now? What is left is the anterior division of lower trunk. And what is anterior division of lower trunk doing? It is continuing as the medial cord of brachial plexus. So this is continuing as medial cord of brachial plexus, continuing medially as the ulnar nerve. Yes, it will continue medially as the ulnar nerve later as well. So this is the diagram which will tell you the details again. Means continuation. Yes, continuation. You see, this is the lateral cord and the posterior cord and the medial cord. So if you say this is lateral, posterior and medial cord, what is this lateral cord doing? See, these cords are actually related to axillary artery in the axilla and accordingly named. You mean to say, if the cord is lateral or posterior or medial to axillary artery, hence they are named? Yes, in the axilla is axillary artery and according to relation they are named. So what is the continuation of the lateral cord of the brachial plexus in the axilla? Lateral cord of brachial plexus in the axilla, if you see, if you are looking at the lateral cord of the brachial plexus, if you are looking at the lateral cord of the brachial plexus in the axilla, it will continue as the musculocutaneous nerve. And what about the posterior cord of brachial plexus? If you say posterior cord of the brachial plexus, it will continue posterior to the axillary artery as the radial nerve. And what about the lateral medial cord of the brachial plexus? Medial cord of the brachial plexus will continue as the ulnar nerve. And what about the median nerve? Median nerve, we have known that there will be contribution by the lateral cord and the medial cord, and that is the formation of the median nerve there. So basically, there are few major nerves which we have to remember. Which major nerves we have to remember? See, musculocutaneous nerve is continuation of the lateral cord of the brachial plexus, that you have to remember. And what about the medial cord? If you are talking about the medial cord, you will see that this is the medial cord of brachial plexus, which is continuing as the ulnar nerve. So this is continuation as ulnar nerve. Yes. And what about the radial nerve? If you are talking about the radial nerve, you can see this is the radial nerve, and radial nerve is actually continuation of the posterior cord of the brachial plexus. So posterior cord of brachial plexus continue as the, I think we'll have to draw a diagram now. Yes, you have to draw a diagram. Let us draw the diagram. As you draw the diagram, you will see some branches in the axilla. But first you have to talk about the cords. See, there will be a lateral cord of brachial plexus, there's a posterior cord of brachial plexus, and there's a medial cord of brachial plexus. And this lateral cord of brachial plexus continue as some nerve. Posterior cord will continue as another nerve, and medial cord will continue as another nerve. And how these nerves are named? See, this is the axillary artery in the axilla, and as you see the axillary artery in the axilla, that will decide the name of the cords, whether the cord is lateral to the artery, whether the cord is lateral to the artery, or it is behind the artery, or it is medial to the artery. And then what is the continuation? As you're talking about continuation, you'll find that the lateral cord is continuing as the musculocutaneous nerve in the axilla, and the medial cord is continuing as the ulnar nerve in the axilla, and posterior cord will be continuing as the radial nerve in the axilla. So lateral cord of brachial plexus will continue as the musculocutaneous nerve. Medial cord will continue as the ulnar nerve. The posterior cord of brachial plexus will continue as the radial nerve, and then you will see how the median nerve is formed. Actually, what we have found is the lateral cord and the medial cord will continue towards the median nerve. So this is the median nerve which will run in the midline and contributed by the medial cord of brachial plexus and also the lateral cord of brachial plexus, and then the median nerve is formed. Now what we want to know is the 5 branches of the posterior cord of the brachial plexus. As you want to know the 5 branches of the posterior cord of the brachial plexus in the axilla, there is a mnemonic goes by the name stars. And let us discuss the stars, the 5 branches of the posterior cord of the brachial plexus. So what is this upper S and lower S? There is upper S and lower S, and this upper S and the lower S are actually going under the scapula to form subscapular nerve to supply subscapular muscle. So there is upper and lower S. Yes, this is upper S and this is lower S. You are telling that there is one upper S and there is a lower S which are going under the scapula to supply a muscle under scapula which is called as the subscapularis muscle. Yes, the muscle is called subscapularis muscle. And the nerves are called upper subscapular nerve, and there is a lower subscapular nerve. Okay, then what about the other part? You see, T is for the thoracodorsal nerve. It is going dorsal to the thorax. We are telling that T is for the thoracodorsal nerve, and which is going dorsal to thorax. Yes. Why is it going dorsal to thorax? To supply a muscle of the lower back. And who is that muscle of lower back? That is called as latissimus dorsi. So you are telling that there is a muscle of lower back which is latissimus dorsi and supplied by the thoracodorsal nerve which is going dorsal to thorax now. Yes, I can write T here, and then there is a R is already there. Oh, this is stars. Yes, you know, S, T, A, R and S, stars. So what is this A for? A is for the axillary nerve. You remember supplying 2 muscle? So if you say A is the axillary nerve supplying 2 muscle, are you talking about the deltoid muscle and the teres minor muscle? Yes, the deltoid, which is a powerful abductor, and teres minor, which is a lateral rotator muscle. So supplied by axillary nerve, a branch of the posterior cord of brachial plexus. What is R for? R, you already know, is radial nerve, and remember, radial nerve is a nerve of extension. If you say R is the radial nerve and it is a nerve of extension, then it is a nerve of posterior compartment also. Yes, it is a nerve of posterior compartment. Actually, radial nerve is a nerve which is continuation of posterior cord of brachial plexus, and it is a nerve of the posterior arm. So what is it doing? It will do extension at the elbow, extension at the wrist, extension at the MCP joint, extension at the IP joint. All the joints here are extended by radial nerve, nerve of extension, nerve of posterior compartment. If you say so, fine. Can we discuss the stars again in a diagram which the examiner is giving us in dissected specimen? So let us discuss the stars, the 5 branches of the posterior cord of the brachial plexus in another diagram, and that is kind of a dissected specimen the examiner is giving, and you see it is here. So we are now looking at the posterior cord of brachial plexus in the axilla. Yes, formed by posterior division of the 3 trunks of brachial plexus passing behind the clavicle. Okay, then what is it giving? It is giving upper subscapular, lower subscapular nerve which will go under the scapula. So there is an upper subscapular, lower subscapular nerve going under scapula to supply the muscle subscapularis. Yes. It's a hybrid muscle. Yes, it's a hybrid muscle because it is having 2 nerve supply. Subscapularis muscle. Then what about this T? T is the thoracodorsal nerve. It is going dorsal to thorax. But why is it going dorsal to thorax? To supply a muscle of lower back. And who is this muscle from lower back? That muscle which is coming from lower back is called as latissimus dorsi. And latissimus dorsi is going to insert into floor of the bicipital groove on the bone humerus. This is latissimus dorsi coming from lower back. Yes, and then it is coming to insert into the floor of the bicipital groove in the bone humerus. Yes, it is there. See, what is it supplied by? It is supplied by this nerve, and that nerve is called as thoracodorsal nerve. And what about the axillary nerve? Axillary nerve is given the axilla and passes the quadrangular space to reach the surgical neck of the humerus and run with one artery which is behind the humerus, around the humerus. So behind the humerus, around the humerus, you mean to say posterior and circumflex? Yeah, posterior circumflex humeral artery, branch of axillary artery. You are telling that this is axillary nerve which is given in the axilla, yes, by the posterior chord of brachial plexus, and then it is going to enter quadrangular space with some artery which is behind the humerus and around the humerus. Yes, that is why it is called posterior circumflex humeral artery, branch of the axillary artery. And where are they going? Both of them will be in the quadrangular space. Then they go to the surgical neck of humerus. And when they go to surgical neck of humerus, what is the importance? If there is a fractured surgical neck of humerus, axillary nerve is damaged and two muscles paralyzed. Which one? The deltoid and teres minor. Deltoid and teres minor. And what about the radial nerve then? Radial nerve is the nerve of the posterior compartment. It is going behind the humerus now. So when you say radial nerve is a nerve of posterior compartment and going behind the bone humerus, what is it doing there? It is in the radial groove and supply the muscles of extension here in this region. Muscles of extension is a nerve of extension. Okay, we'll discuss the details about the radial nerve later. At this moment, this is stars. What is stars? The 5 branches of the posterior chord of the brachial plexus given in the axilla, the stars.